Hello. Hi. My name is Jessica Sheffield. I am an occupational therapist here at the Riverside Shoreview outpatient. Let's talk about where we are located. We are located on Chesapeake Avenue, right here next to the water, right on the border of the Hampton and Newport News city line. We are located right next to where the old Riverside Rehab Hospital used to be. Some people know it as the old Mary Immaculate Hospital or the old Buxton Hospital. So we do offer all three therapy services here: the physical therapy, the speech therapy, and occupational therapy. So there's that. So we are going to go ahead and kind of jump into the presentation. So how to avoid a computer hunch. So why are we talking about it? Why is it important? Especially right now, due to COVID-19, there are more adults, more children working on their laptops, desktops, tablets at home. Of course, some adults are still going into work, so it's still important for them as well. So it's important because I want to educate you on the recommended body positionings while working, as well as stretches that you can be doing. We want to help create some good habits because, especially now, more people are working on electronics. We want to prevent negative long-term effects on our bodies. We want to help prevent any stiffness, any pain that occurs when working for long periods of time in front of the screen. So let's talk about the children first. So our kids, as you guys know, are working at home on tablets, laptops, desktops. So the biggest thing is, depending on where they're working, if they're working from a kitchen table or a dining room table, depending on the age, as you can see, the first picture, chair can be too big to allow for proper seating position. So we really want to make sure that we are looking at their hips and their knees. We're really looking for that 90-90-90 position. So their back really needs to be up against the chair. If they're smaller, putting a pillow or two can help, putting it behind their back so they're more upright. Or if the chair if they're too short, you can potentially put a pillow or two under their bottoms. And we're also looking at their knee. We really want to make sure that their knee is that 90 degree. So putting a footstool under their feet, or potentially stacking up some books to allow for that good position of their knee being at 90, their hip being at 90. And then the biggest thing is we're looking at making sure that the tablet, the laptop, is at eye level. We definitely don't want their necks to be looking down. We definitely don't want their necks to be looking up. We really want to make sure that they're eye level. And the reason why the height is important is that we don't want their hands to be like this, working on the laptop. So we really want to make sure that we kind of bring them up. If they're in an office chair, that's ideal because then you can kind of, elevate the chair. Again, making sure that their back, their hip is at 90. So putting up pillows behind their back. Now, for some parents, I know they have set up, as you can see the picture to the right, kid table and chairs. That's fine. We really want to make sure, their feet is on the floor, that their knees are at least at 90 degree, and then they're scooted up with a good posture, hips at 90. Now, this is where the problem can come into. If there's a kid table, their head's going to be more down. So we really want to make sure that you're putting books under the laptop to bring it up so that they're, again, at eye level. So this is actually some alternatives here. Kids are made to be moving. We know that. We can't expect a child to be sitting at the kitchen table for 5, 6, 7 hours a day. So these are a couple of great opportunities for them to change it up. Putting them in prone position on their tummy. Great for, input for their bodies, but then also upper body strengthening. And here you do have to be careful because it's very easy for them to be looking straight down. Again, try to prop it up so that it's, again, eye level. And then if you have access to like a peanut therapy ball, this is great because it allows them to kind of shift their hips and move while on the laptop. Another example could be that they're on their knees, half kneeling, looking up on the laptop, just again to change up their position. Now let's talk about adults. So we're going to talk about desktops. I know they're not as popular, not as common, but of course, if you're in the office, you're definitely seeing this. We're looking for that 90, 90, 90. So 90 at the hip, making sure that you have good proper positioning of the back of the chair, making sure your knees also at least 90 degrees. So if you're on the short side, having a footstool under your feet to help bring that up so that we're not putting a lot more pressure on our hips. And then the elbows. So if you're sitting in a computer office chair, you have your armrest. A lot of times those armrests can be a little bit on the high side. So then it kind of, you put your arms on it, it kind of elevates your shoulders a little bit. As you can see over time, you're going to start having issues at the shoulder and the neck. So we really want to make sure you're adjusting the height of the armrest just so that you can just barely rest it if you need to. But the idea is making sure that you're 90 degrees at the elbow, but then we also want to make sure your wrists are at kind of a neutral position. So, of course, I know you guys seen those wrist foam things that you see in front of the keyboard. Be careful with those. Some of those kind of put your wrist in a kind of over a hump just to be able to type. Of course, as you can see, over time, you could eventually start developing carpal tunnel issues, wrist pain, stiffness, things like that. So really be careful with those wrist foam. Make sure that if it's giving you a hump, then I'd rather you remove it so that you can allow for neutral position with the wrist. With the desktop computers, sometimes you can flip a tab so you can elevate the keyboard from the back end. Again, be careful here because then that's going to extend your wrist a little bit. As you can see over time, we can start having issues with that. So the idea is making sure that you're 90 at the elbow, neutral at the wrist for documenting. The last piece is that we're looking at, again, eye level with the monitor. So a lot of times the desktop monitors, you can adjust it. So sometimes that's an easy option to make sure you're maintaining the 90, 90, 90 with your hips, knees, and your elbows. So this is an option. Now, of course, now more people are working on laptops. So this is where, again, we want to still think about that positioning. So if you're looking at a laptop and you're sitting on your couch, obviously you're not getting that good and you're hunched over, you're going to start having more issues with your neck straining, back. So we're looking for making sure that you are keeping that laptop more eye level. So I like to show you this example that we have. Of course, right now, it's a rainy day, so a lot more people maybe want to be in the bed and working from home in the bed. If you're working in the bed for a few minutes, that's one thing. But if you're in the bed for several hours, I'm sure if you already have done this, you probably felt a little bit more pressure on the back, more on the neck, shoulders, the top of the shoulders, because this is not an ideal position. So as you can see, the woman we have here on the right, perfect. She's in an office chair. You can see the armrest is about right. So if she was to bring her arms back, it's going to allow for at least 90 degrees, no less than 90 degrees. And then, of course, she's put her laptop on top of a drawer stand. And then she actually has a keyboard attachment. So that allows her from keeping her from being up like this, really kind of keeping her wrist to neutral. So this is good. The only thing I would say is that the laptop is just not high enough. She still is kind of looking down into towards the laptop screen. So we'll probably have raised that up a little higher. So there are a couple of options when it comes to lifting up the laptops. Easy fix, a box, books, stack them up. That's the easy way. If you would like to purchase something, there are lots of options out there. You can purchase them as little as $15. You can get up to $50. They're either called a laptop stand, the one on the left. You can adjust the height of it, or you can get a laptop riser where you can angle it. Of course, with a laptop riser or a stand, you will have to potentially look into a freestanding keyboard attachment. So that way you're not putting your arms up like this. It's more allowing your elbows to be at 90 degrees and your wrists in neutral. So before I get into the stretches, big thing that I like to tell people is that you kind of get into this mode, you get on to this laptop or your desktop and you start working. And sometimes time just flies by and before you know it, 3 or 4 or 5 hours has went by. What I always like to encourage people is making sure if you're one of those people that you get into this mode and you're not easily distracted, make sure you have a timer. You can do it on your cell phone, set a timer every hour. Because my general rule for taking a break is between 5 to 10 minutes or having a 5 to 10 minute break every hour. So either timer on your cell phone, or you can go to the, traditional timer that you would see in the kitchen for baking, putting one of those on so that you have an hour. And then that way, when it goes off, oh, I need to take a break. The breaks are good if you do it every hour, because that's going to help ease the muscle ache because you're in one position for so long. Reducing the eye strain because, again, laptop, desktop, tablets, it's a lot of pressure on our eyes. And then also it's a nice stress reliever, because if you're stressing out and you're really working, and it's a good way just to kind of take a break, let your brain just to kind of relax for a few minutes. So this is important. Now with those breaks, what I mean by a break, if I'm working on the computer, laptop, making sure you're getting up and you're getting away from the laptop. You're getting up, you're standing up, you're moving around. A good opportunity to complete some stretches that I will show you in a little bit. It's a good opportunity to drink some fluids, because again, we're not drinking enough fluids like we should. So this will make sure you're staying hydrated, or bathroom breaks. This is a great opportunity for that, making sure that we are staying regular. Okay. So the first thing we'll talk about is eye straining. I always like to talk about the 20-20-20 rule. Taking a break for 20 seconds to look away 20 feet for every 20 minutes. Now, if you are a parent working from home and you have children, this is kind of an easy one, because you're most likely, you have them where you can supervise, making sure that they're doing their work. So you just glancing over, checking on your kids, and then coming back to the screen is good enough. Now, if you feel like if you already do have some eye troubles, or if you tend to get headaches, this may be something that you may want to set a timer to kind of create that good habit of looking away. But this is really important, just to give our eyes a break. Now, let's talk about some exercises. Let me just put out there. First thing is, if you have an exercise, if you have back issues or neck issues or shoulder issues, any of those things, or if you have any concerns, please talk with your doctor first, your primary care doctor, to make sure it's okay for you to do some of these stretches, exercises, because we do not want to cause more harm. Now, if you do these exercises and you have any pain or discomfort, we want you to stop doing the exercise. A lot of people are like, oh, no pain, no gain. No, that's not what we're looking for. We're looking for stretching. Stretching should feel good. You should feel that stretch pulling, but it should not be painful at all. It should be pain-free. So if it's painful, then back off a little bit or stop the exercise. So the first one, if the shoulder squeezes, these are pretty easy. You just kind of bring your shoulders back. So you got 2 shoulder blades. Pretend there's a pencil in between your back, and we're just simply squeezing. Now, some people want to kind of shrug up and back. That's not what we're looking for. We're not trying to hike up our shoulders. We're simply just bringing them straight back. The other one are the shoulder rolls that I'm going to kind of start pulling this out a little bit. So with the shoulder rolls, we're looking for here backwards. Okay. When you do the shoulder rolls, it is not uncommon to get a little bit of popping feeling. I get this. Now, what should happen is after 2 or 3 times, you should feel that go away. I don't like doing the forward, because we're already wanting to be like this with our laptop looking down. So we want to discourage that. We want to think about sitting up tall and the shoulder rolls backwards. So go ahead and stand up. Okay. Now, these are all optional exercises. I don't expect you to do them all within one 5 to 10 minute break. Change them up. So every time you get up, doing some arm circles are great. Just getting that forward, and you can get kind of big. And even for me, I feel it. Okay. Going backward, it's just going to feel good. The cross body arm stretch, where you just bring in your arm across the body, you will probably, for some of you, will probably feel more of a stretch on one side than the other. That is okay. If you feel more of a stretch on your right side than you do your left, that means you probably need to stretch this side a little bit more. I always like to do a stretch and hold for a few seconds, 5 seconds, up to 30. Don't feel like you got to be quick, okay? But this is just going to help to kind of loosen you up. Now, the other stretches, and again, if you have any back issues, any cervical pain issues, anything like that, please consult with your doctor to make sure that these are okay and safe for you to do. The side stretch where you're just leaning, reaching over. This one's a great one because we're getting you out of this position, but out, okay? So you're doing it both the left and the right. If you feel more of a stretch on one side than the other and you want to take more time on that side, go for it. The next one is the arch back stretch. That's simply just reaching back, arching your back, because again, we have a tendency to be sitting forward, looking forward with our head forward. So we want the opposite motion. So stretching it back, you can even throw your arms back. If you have good balance, if you don't have good balance, maybe hold on to a chair. But reaching back, sometimes just that yawn, really getting on our toes and really touching the ceiling, those are all really good for you. The biggest thing is really just moving. Movement is good for our bodies. Our bodies are not made to be sitting in one particular spot for 5, 6, 7, 8 hours. So that's where a lot of times you're feeling that stiffness. That's where you feel pain. That's why you get that headache. And a lot of it is if you're not getting up and taking those breaks to relieve the muscle ache and the eye straining, then that's where you're going to end up in trouble. The biggest thing is what we don't want to see. We don't want to see you here in therapy because of the poor positioning and lack of stretching, and so we want to make sure that you're getting up and moving. So that is it for me at this point. Well, if we have any questions, kind of go from there.
So we have had a few questions.
Okay.
If I have developed a nagging pain over the last few months, what should I do?
Okay. So if you have developed some nagging pain, especially to be expected with the COVID and if you're working more from home, what I would definitely do is get in contact with your primary care provider, potentially get into the office with them for them to take a look at that. Because definitely what you don't want to do is just let it slide, let the pain get worse. 2-3 years from now, you continue to have that pain. So if you are developing that, go and meet with your doctor. They may just say, you know what, let's get you in some physical therapy or occupational therapy, do some stretching, maybe some exercising and that kind of thing. So that's what I would do is I would, for sure, meet with your doctor. And if you are doing some of these stretches, if they're helping, then great. But if you find that you're still having more pain with it, or you know what, I really encourage you to go see your doctor.
Great. Are there lighting guidelines both in the room I'm working and in the brightness of the monitor?
So, okay. So my 2 cents are, you don't want to have the room turned off because, especially like I said, a lot of people want to be in their bed because they're still not waking up. They're in the bed, the lights turned off. And if you're planning on working for many hours at a time, I would definitely discourage that. Turn on the lights. I think the lighting that you have in your home is just appropriate. If it's broad daylight, you have lots of windows, that's good. I know some people will unplug their laptop cord that charges the laptop, and they change the power setting to make it a power saver, so it kind of dims the laptop. I do not encourage that because that's more eye straining. So you're saving the battery power to strain your eyes. We don't want that. So just, your traditional, like your average lighting of the laptop is appropriate, or your desktop is appropriate. And just make sure you're in a well-lit room.
All right, thank you. And the final question, are there long-term effects from bad posture?
Yes, absolutely. We see this a lot. here in therapy. Long-term effects of bad posture, if you're stooped over, your breathing is more affected. You're not able to take that deep breath. Your range of motion, your arms, you can't reach up as high versus when you're sitting up tall. It really does make a difference in your balance when you're walking if you're more stooped over, and if you don't do anything about it, and you eventually, your muscles are too tight, and it's going to take more work, more therapy to kind of break that habit. So it's really important for us to really be focusing on sitting upright, having that good posture, because it does affect your whole body.
All right, great. Thank you for joining us. Thank you for your presentation.
Thank you.